Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health in the Peoria Metro Center and our YouTube channel, Health and Horsepower. This week, I want to talk to you a little bit more about arthritis and how it's actually preventable and reversible. So you may or may not know, but when you look at the joints of your body and the joints of your spine, they are separated by cartilage that helps to keep not only shock absorption, but also fluid within the joint to lubricate the joint and make sure that it's not grinding like bone on bone. When we have injuries to our joint or to our ligaments or the soft tissue surrounding it, a lot of times what happens is we put different weight loads and pressures. So for example, say you've injured your knee and you're walking funny or hobbling or limping, or you've injured your back and you tend to stay in a certain position to prevent pain. That's going to cause uneven pressure on the joint that can actually cause it to wear down and start to fail in a specific way because you've injured it previously. So a lot of times in my office, I do find if you've had an injury in the past or you're new to having joint pain, we may actually have to make sure that the joints are moving properly first, and then also rehabilitate the soft tissue, so the ligaments, the muscles, and also the cartilage to make sure it's got the nutrition that it needs and also the right exercises to help restore normal motion. Because what tends to happen is, again, when that joint's not moving properly, we tend to wear it down a specific way that causes it to fail and break down and form degeneration and arthritis because of the biomechanics that got it there in the first place. So if you're having joint pain or you know somebody that's having joint pain and they haven't been evaluated by a chiropractor that specializes in spine and joint injuries, they may need to get evaluated if they want real answers and results that actually last. A lot of times when we go to a medical doctor or if we go to a prompt care, they may give us pain relievers and anti-inflammatories or muscle relaxers to help reduce pain, but it doesn't really do anything to restore normal joint motion. In my office, I want to make sure that your joints are moving properly. And like I said, we have the right nutrition and the right supports for your cartilage. And we're working on actually retraining the muscles and ligaments and then the soft tissue to make sure that that soft tissue knows how to stabilize your joint, keep it moving properly, and make sure it stays moving properly. Because otherwise, when we have a joint that's not moving, that's wearing and tearing down, eventually you're going to see a point where that joint breaks down and we might need a replacement, we might need a surgery, or the pain might be so significant we can't get about our daily lives. So if you or someone you know is having issues with arthritis or with joint pain and hasn't gotten it checked out, I would highly recommend setting up a consultation in our office so we can give them answers and some possible solutions or things they need to work on. Because let's face it, the longer you wait, the more damage is done, and it's a lot harder to reverse arthritis than it is to prevent it in the first place. So definitely get checked out sooner rather than later, because if you don't and we have that joint breaking down, that can form premature arthritis that happens a lot faster than it's supposed to. And that can also cause a lot of pain for you, but also cause a lot of complications with how long it takes to get better. So if you want more information, set up a consultation in our office and we'd be more than happy to help you.